Hello guys, Dr. Emmanuel here. I'm back with another video about PLAB 2. Today we are continuing with history taking. As you remember previously, we were talking about history taking, introduction, introducing yourself, greeting the patient, and then asking about the history of presenting illness. Remember, we said that if you want to ask about the history of presenting illness, you will ask, how may I help you? Or you can ask, what brings you to our clinic today? Now, what is the importance of the HPI? The HPI is very, very important in every station that is history related. Why? Because if you do not find your diagnosis in the history of presenting illness, there is very little possibility that you are going to pass that station. Why? Because you are going to panic, you're going to ask unnecessary questions, you're going to waste time, and eventually you will fail the station. Also, if you ask the right questions in the HPI, you will find the diagnosis faster, you will save time, and you will end up finishing the station in time. Okay, so let us go straight to the HPI. So the five most important aspects of the HPI are exploring the chief complaint, asking about other symptoms that are related to the HPI, asking about complications of the condition, and important differential diagnosis. Now, let's talk about exploring the chief complaint. So we use Socrates and Odipara. So you all know Socrates, we have seen it in junior clerkship, and you all know Odipara. We use Socrates for all chief complaints that are pain related, and this one we use for non-pain related chief complaint. So Socrates in full is site, onset, character, radiation, associated symptoms, timing. E is for elevating stroke aggravating factors, and S is for severity. Now, the most important thing about Socrates is knowing the order in which you ask the questions. Remember, it is impossible to pass PLAB 2 if you do not know how to Socrate the patient. Nearly 50% of the chief complaints are going to be related to pain. So this is how we ask. We ask about the site, the onset, the character, the radiation. We leave the associated symptoms for the last part. We can ask about timing, we can ask about elevating or relieving symptoms, and we can ask about severity. Now, Odipara is onset, duration, intensity, progression, aggravating factors, relieving factors, and ACE for associated symptoms. We will talk in depth about Socrates and how to Socrate the patient. Now, other symptoms. For example, if your patient is having chest pain, you ask the patient, you Socrate the patient, they tell you about the chest pain, where it is located, where it is radiating, and relieving and aggravating factors. And in your mind, you know that this is chest pain related to myocardial infarction. To confirm your diagnosis, you want to ask one or two questions that probably the patient has not told you. So you will ask, for example, are you having any difficulty in breathing? Are you having any nausea? So remember nausea. We ask, are you by any chance, are you feeling sick? Remember, feeling sick in the UK is equal to saying, I'm feeling nauseated. So we ask, are you feeling sick? Because we do not want to use any medical jargon. Yes. So if they are having chest pain, nausea, difficulty in breathing, sudden onset, you know probably the patient is having myocardial infarction. Other complications, you can ask other complications related to the diagnosis in your head. Important differential diagnosis, probably if it is chest pain, you want to rule out things like pulmonary embolism. You want to rule out pericarditis. So this only happens if you have asked about Socrates and you still do not know the diagnosis. But if you know the diagnosis, straightforward, ignore about important differential diagnosis and go straight to the past medical history. So let's talk about Socrates. S. Site. How do you ask the patient? You ask the patient, where is the pain? Where is the pain? They will tell you, oh doctor, it is on the left side of my chest. Would you please point for me where the pain is? They will show you. Then onset. Now there are a few questions we ask here. We ask, when did it start? How did it start? Was it sudden? Was it gradual when it started? And then what were you doing when it started? What were you doing when it started? So they'll probably tell you, doctor, I was just sitting down. Or sometimes they can tell you, I was walking uphill. Then you will know probably this is stable angina. So site onset, we go to character. Character, you ask the patient, would you please describe for me your pain? Describe. So they are going to tell you, oh, it is dull pain, or it is sharp pain. Or they can tell you, I feel like something is constricting my chest. Then you can know then this is constrictive chest pain, is most likely myocardial infarction. So character, radiation. In radiation, you are going to ask the patient, is there anywhere else that your pain goes? Or does your pain go anywhere? They will tell you, oh doctor, it goes to my jaw. Or yeah, they can tell you where it radiates. So radiation. And then remember, we said we are rearranging Socrates, so you're not going to ask about associating symptom. You're going to ask about aggravating stroke elevating symptoms. Stroke elevating. So how do you ask it? Is there anything that makes your pain worse? Is there anything that makes your pain worse? And then they will tell you, oh doctor, the pain gets worse when I work out. And then you can ask, is there anything that relieves your pain? That relieves your pain. They will tell you, maybe it's relieved by rest, or it's relieved when I take a painkiller. Yes. Now, severity. Very important to know this, how to ask this. You will ask them on a scale of 1 to 10. Sorry. On a scale of 0 to 10. 0 being no pain, and 10 being the worst pain. Worst pain. Where would you score your pain? If they tell you the pain score is anything above 8, you know this is very severe pain, and it will also guide the kind of painkiller you're going to give the patient according to your pain score, according to your analgesic ladder. Now, finally, you ask about associated symptom. So this is how you ask it. Apart from the chest pain. Anything else? They will tell you, oh doctor, I'm having difficulty in breathing. Or, oh doctor, I am feeling sick, to mean I'm having nausea. So that helps you to come up with a diagnosis that this is chest pain due to myocardial infarction. Thank you.